What's going on, guys? Welcome to week number 7 of TPI Tuesdays. I'm Matt Santoro. I'm a doctor of physical therapy as well as a TPI certified medical practitioner. Now today on TPI Tuesday, we're going to be talking about the neck or the cervical spine. So let's get in with some anatomy just as we always do. The cervical spine is made up of 7 spine segments or vertebrae up from the neck to the head. So what's interesting about the cervical spine compared to the rest of the spine, the thoracic spine or the lumbar spine, is that these vertebrae are shaped differently depending on which part of the cervical spine we're talking about. The two higher up cervical vertebrae, C1 or C2, are shaped differently, which allow us to do things like rotate our head a little bit further or even look up and down. So the mechanics are a little bit different, so the presentation or shape of the vertebrae has to be different in order to allow for those different motions. At the cervical spine, we can do things like look up or extend the cervical spine. We can look down, which is called flexion, rotate to the right and to the left, or do something called lateral flexion or side bending, which tilts our head to the right as well as to the left. So we're going to break the muscles down into some groups. We have our cervical extensors, which allow us to look up. And those would be muscles like the upper trap muscle or the splenius capitis muscles. We have the cervical flexors, or the sternocleidomastoid, or the SCM as people call it, which allow us to look down. And for the rotators, it's often a combination of flexors and extensors on one side. When they both contract together, instead of looking up and down at the same time, which obviously we're not able to do, we get some rotation in there. Now at the neck, there's also a couple of other muscles called the scalenes. Now those muscles allow us to breathe. So think about when you've just done some running, you're a little bit winded, and when you breathe, the ribs elevate and come up. The scalene muscles connect the lower part of the cervical spine, go down into the first rib, and pull upward. We're going to talk about the implications of those muscles just a little bit in the role in life. We're going to see what's going on at the neck in the TPI screen with the cervical rotation test. And if you watched last week's video, so I did that with Joe. Joe didn't pass that test. He wasn't able to tuck his chin all the way down, which we would want to see in an efficient golf swing. Now, in the golf swing, the neck allows us to rotate the spine. You might be thinking, well, shouldn't the thoracic spine or the hips be creating that rotation? And the answer is yes, in a way. But think about it this way. While we address the ball, if we rotate our spine, the head has to stay looking down at the ball, which allows us to use good hand-eye coordination to make contact at impact. Now, if the neck wasn't able to rotate as we came into the backswing, we would take the head with us. We'd be looking away from the target line, not being able to see where the ball was, and with some luck we might hit the ball, but it wouldn't be as consistent as we would want it to be. So think about it this way. If we were to rotate our head to the left, it's just like moving into the backswing for a right-handed golfer. Now in life, the neck allows us to move the eyes, the ears, and the nose to improve our sensation. When we hear something, we are able to turn our head, try and match up a visual with what we just heard. Now again, like we just talked about with the scalenes, those scalenes allow us to pull the ribs up, which help to expand the lungs. Though it's not the most efficient way to breathe, it is a strategy that the body is able to use to increase oxygen. Now, some effects of inadequacies that we can see in the golf swing as a result of poor neck mobility or stability will be things like a loss of posture, early extension, and a reverse spine angle. Based on how the neck is moving or not able to move, we might try some other ways to get the club to the ball that, again, aren't as efficient as they might be. And in a way, that could be because we have a relatively poor amount of thoracic rotation if the neck doesn't allow us to get back further into the backswing. In life, some inadequacies that we could see would be things like moving the head while we're driving, so checking traffic before we go at a red light, maybe some mid-back pain or some shoulder pain. We've talked about this concept a couple times. The body's going to try to compensate, so when the cervical spine, which should be a mobile segment, isn't able to move because of rigidity or stiffness at the joints or at the muscles, the section below that or above that is going to try to compensate. So many times we'll see people coming in with a stiff thoracic spine or stiff mid-back, trying to compensate for some of the loss of stability that's occurring at the neck. So I'm going to go get changed. I'm going to show you guys a great way to help improve your cervical spine rotation by adding some extra stability to the problem. Don't go anywhere. I'll see you soon. Alright, what's up guys? Welcome back to the fixes component of the cervical spine talk. So, just as I've done before, I'm really going to advise everybody that if you do have a problem with cervical spine mobility, or you feel like some cervical spine stability, I'm highly going to recommend that you go see a professional. There are a lot of problems that can happen if you try to take on fixing your cervical spine yourself, and for your health benefit, keeping you on the course, keeping you enjoying life more, we're definitely going to want you guys to be treated by someone that has some training in the cervical spine. So going to see a good physical therapist, coming to see us at Advanced Physical Therapy at Freehold, or going to another practitioner. Really go get yourself checked out by someone who's very knowledgeable about the cervical spine. But if you insist on trying something at home, be careful, be safe, and if there's anything wrong, stop. So, a technique that you guys can use at home to help improve cervical spine rotation is to add some stability to the rest of the body. So what we're going to do is we're going to take the band here. These are pull-up assist bands, and it's a fairly low tension, so you're going to be able to work with it relatively easily. And by pulling this apart as we're lying down and rotating our cervical spine, we're going to be able to give the body some extra stability through the core and through the shoulders to help the body recognize that it's able to do more than it thought that it could before. So, just as we've set up with before, I'm going to have you lie down with your knees bent, head back, press the band up in front of you, and pull apart. That's going to activate your core muscles. So tighten all those up, and then rotate your head as far as you can to the one side. Hold that for a couple seconds. Return to the center, and repeat to the opposite side. Hold that a couple seconds, and go back. When you're done, slowly let the band contract. Sit up and enjoy a brief rest period before you continue with another set. Like I said before, the stability that the body needs in order to rotate the spine is achieved by pulling that band apart. It allows us to look further over to the right as well as to the left. So give that a shot at home. See if we can get your cervical rotation better, which is going to allow you to rotate further into the backswing and the downswing, allowing you to hit the ball further, longer, straighter. So, as always, if you guys have any questions, leave a comment down below or give us a call. Our phone number is 732-720-2566. I'll see you guys next week on TPI Tuesday.